Hi, I'm Dr. Hakim, consultant orthodontist, diplomate in the American Board of Orthodontics, practicing here in Dubai, and welcome back to our third episode. Last time, in our second episode, we discussed on-time orthodontics, and we really went into quite some details regarding the treatment of children. Now comes the question of adults, and oftentimes, whenever an adult patient is recommended to have orthodontic treatment, there's a little shrug and a concern. And the problem is that they think it's just braces. So today's episode, we're going to discuss that orthodontics is more than just braces. See you. So welcome back again. This is the third of our episode in our series of podcasts. And we really appreciate all the feedback we received last time for the last episode. And hopefully in today's episode, we're going to address the subject of adult orthodontics. Now, I know I am currently having Invisalign treatment as an adult, and so is Dr. Omar.
Yep. Hello.
And I know you're behaving with your retainers, so you avoid adult orthodontics. So today, like we said, it's more than just braces. Whenever adults are recommended for orthodontic treatment, that's the shrug. So let's see. So for what the last patient you saw who was an adult who needed orthodontics, could you just tell us what was their case and what was recommended for them?
So actually, the last patient that was at the clinic, he was already using braces for actually a long time, fixed braces, but he was not that motivated with the treatment. It's been a long time. He was not doing the adjustments and everything, and actually he was from the sports again, and back to the sports, and he was not feeling comfortable with the braces, and he was asking about the Invisalign, how it works, if it's possible to still do in his case. And that's something that I realized that he was not motivated with that. And as soon as I told him, yeah, like your case, we can do an Invisalign case. We can change for the aligners. I think it might be more comfortable. You're going to be able to wear and even protect your teeth once you are you're training. You're not going to get hurt with the fixed braces. And that kind of switched the whole idea of braces for him. So he got all excited, and anyway, it's willing to start, and is gonna do like that. He did actually the records, and we're gonna replan. And now with the goal and with the treatment that he's gonna be more comfortable, and he's gonna be more motivated for that.
He was never offered a line of treatment at the beginning?
No, exactly.
Just
exactly.
braces.
He had the braces on. He was not almost 8 months without doing any treatment. He was willing actually just to stop, because he even said that, I don't think my case it's for braces anymore. And he was actually young. He was like 35 years old.
I can understand that. I can see where he comes from, and it's the same with me. Like, had my teeth straightened when I was 13, but bite is not right. Smile was good, but bite, I still had some problems. And a lot of them happened because, yes, I stopped wearing my retainers. So always wear your retainers, guys. Teeth moved again, jaw collapsed a little bit, and then my growth worked against me. But I didn't want to put braces again. But I knew about aligners, of course, as being an orthodontist, we learned about it. But I also knew a big problem for me was to correct my, let's say, malocclusion. I needed also surgery. Like the traditional way to make my jaw wider, because with more expansion I had to get it, as you know, split from the middle, and we widen it up with an expander. However, getting into the work, the courses we've done together, mini screws, expander, the new, let's say, modality that we're moving towards is using mini screw expander. And what works great with them? Aligners. So suddenly what I didn't want to ever correct, that misalignment of the bite, because I didn't want to put braces on or I didn't want to go through surgery, out of nowhere, I actually now want to get it corrected because the options changed. I can have clear aligners, so I don't have to have anything visible on my mouth, teeth. I don't want to go through the whole food getting stuck between wire, brush and clean, all that. We go on meetings, courses and all that. I didn't want that, having something on my tooth to be an obstacle, like with many people here in Dubai, as you can imagine. CEOs of companies, businessmen, clients, that are people
Cabin
facing.
crews that are not allowed to use anything.
Yeah,
that
they don't
shows
want
up.
anything that shows, so they go for aligners. And for me as well, the fear of having surgery, I thought, why do surgery for bite correction suddenly now can be avoided by simple putting 4 mini screws done by us orthodontists, not even a surgeon. We don't need to go to sleep for it. Very simple procedure, chair side, usually in half an hour, you're in and out, and then get an expander device to it. And here you go, working. Yes, maybe not as fast as if we did it with surgery. We could have gotten it corrected quicker, but
It will fit your lifestyle.
I don't know about that. I think I've treated many surgical cases, and what I feel is that the body is about the same.
Okay.
And whenever we do surgical cases, there is a period where patients have to recover. So whether it's take time off work,
Sure.
Unable to do certain activities, and
The
that,
aesthetic part also, that's a major
and
thing.
I'm about to touch on that, and that's why kind of we developed this approach where we're expanding jaws in adults, the upper jaw, and this could be, like in your case, for bite correction. It could be because of a constricted airway. But the approach we take, or the approach we take, is that we expand slowly. Okay, we don't do the rapid expansion and we split and there's a big gap. I think this is a concern that I'm often asked. If we are going to expand skeletally, if it's done by surgery or some of the other mini screw techniques, there's a large gap that forms. So the way where I do it and the way we do it is we expand, and it's kind of going in parallel with the aligners. With the aligners, and that way, so we've expanded quite a bit, and there's no gaps. So that's fantastic.
So it's good to know, like you're saying. So yes, maybe. So timing is the same. It's just maybe I'm slower with the expansion bit, but I'm not dealing with having to sit and wait recovery, swelling, big gaps, having other things done. So in essence, they end up being in the same path, same time.
And that will suit like the time of you, like
you
said.
It's great for my lifestyle.
Like, exactly.
Never
this is the third
break.
time, so I'm sure you. It's still a big treatment. It's still a lot of going on, but the things are a little bit more smooth, and I think you
my
can
life haven't changed. Still go to the gym, still go scuba diving, still go climbing. Like it's all life is still as it is as we're doing this.
Exactly. And you serve as a model, also as an example for the patients whenever they ask, because of course
they're beat your heart.
We'll see a picture of the expander.
This is a very good example.
It's a special one.
And it's very nice to see them when they look at you with the treatment going again, third time with expander and aligners and everything going in a very smooth way. It's nice to see their face. Okay, I think that can be me.
Works.
I can do that, even if it's anyway. So we have all these options nowadays, and even for simple cases. I'm a simple case. After 15 years, my case was very simple. I didn't do actually fixed braces at the top. It was only bottom, so very straightforward. But again, the age thing, movement is still happening. So I had to do a very quick treatment with the aligners. It took 3 months, fixed, and now I'm back with my retainers.
Fantastic. And I think it's very important also to stress that adults may seek orthodontic treatment, not just for alignment. Oftentimes we get patients referred to us who would tell us, oh, we're fine with the misalignment, but because they need to replace teeth, because the teeth need to be positioned in a more ideal way to receive implants or to have veneers done, then we do what's called pre-restorative orthodontics. And once again, this can be done with aligners, or it can be done with fixed appliances. And surprisingly, I've come across a few adults who need to have that tester aligner. Because let's try to keep this between us. I have my most non-compliant age or type of patient is actually some of the adults.
Not the kids.
Not
Yeah,
the kids.
not the
Yeah,
kids,
that's
no.
the surprise. It's not the kids.
Because they just they're just so used to things
Yeah.
and all
They
of a
have to
sudden
create a habit. Is
Yeah.
another
they
part
ha-
of the routine.
They have to see the benefit of it.
Yeah.
So I've had but obviously once they get on board, I mean I've had patients who've said, right, because I'm going to start aligner treatment or orthodontic treatment, I'm going to quit smoking. So that they can kind of combine it with that,
Yeah.
and we get great results with that.
Exactly.
So I think there's more than braces. Sometimes we can use limited brackets, and sometimes we can even add additional, like you mentioned, the expander,
Yes.
rubber bands or elastics. So all of
Sometimes
these
we're
things.
hybrid.
Yeah, we could do a combination.
Exactly.
Some braces
Yeah.
in the back possibly, and we can do aligners in the front. So I think with that, we should be very clear that if orthodontic treatment is recommended for you as an adult, there's more than just braces. There's aligners and there's many wonderful options available to you to achieve the desired smile or the desired goal as part of your smile journey. So remember, don't just smile, smile healthy.